Welcome, everyone. My name is Nicole Slennerton. I'm the Director of Communications at the Rutgers Institute for Health, Healthcare Policy, and Aging Research. Rutgers IFH is a hub for multidisciplinary research focused on advancing population health. Our Community Engagement Core is very excited to share a presentation with you today on suicide prevention. Our presenter is Allison Bond. She's a clinical psychology doctoral student with the New Jersey Gun Violence Research Center at Rutgers University. Following her presentation, I'll ask a question, and if you have any questions, feel free to reach out to us at community@ifh.rutgers.edu. Also, check us out on social media at Rutgers IFH on Twitter, Facebook, and Instagram. Thank you all so much for joining us, and Allison, take it away.
Awesome. Thank you so much, Nicole, for that introduction. So I'm going to go ahead and share my screen so we can have some slides up. Perfect. So like Nicole said, my name's Allie. I'm really excited to be here to chat with you guys about suicide prevention. I know we just did a little bit of an introduction, but I'll introduce myself again. So I'm a third year clinical psychology PhD student here at Rutgers in the New Brunswick campus, and I work in the New Jersey Gun Violence Research Center. So my research interests really focus on suicide prevention and the role of firearms in suicide. So a quick agenda for what we're going to chat about today before we dive in. I want to talk about some of the background and statistics around suicide. I want to touch a little bit on suicide during the COVID pandemic. I think this is coming up a lot for people, and there's some questions surrounding this. And then I want to move into a discussion about firearms and suicide and means safety. So I like to kick off presentations with a quick chat about terminology we like to use when we talk about suicide. So in this first column here, you're going to see some less helpful phrases, and then you'll see more helpful phrases and an explanation as to why. So the big one I want to highlight is this phrase, commit suicide. So this is something we hear a lot that we've probably used in conversation, and we actually want to start moving away from using that term commit suicide or committed suicide and use the term die or died by suicide. And this is because the word commit carries a pretty big stigma with it. It's a little bit outdated, and it has some connotations of illegality, shamefulness, and sin in some cases. So again, we're just going to use die or died by suicide instead of commit suicide. And you can see some other examples of just terminology we want to start switching and keeping in mind when discussing suicide and suicide prevention. So I want to chat about the basic facts of suicide, and then we're going to go into rates for some different subgroups of the population. So before we jump into these, as you can see, the data I'm presenting is from 2019. So this is because it takes 2 years for us to get national level data from the CDC. So we just got 2019, next year we'll get 2020. So this is kind of the most up-to-date data we have, even though it's about 2 years delayed. So suicide is and has been the 10th leading cause of death in the US for many years. So that means that every 11.1 minutes, someone is dying by suicide for an average of 129 deaths per day. That's equaling over 47,000 deaths within the year. So firearms account for 51% of all suicide deaths, and we're going to go in and talk about that more. But overall, suicide is more common than death by homicide, auto accident fatalities, and acts of terrorism. Like I said, it's the 10th leading cause of death overall in the US, but it's actually the second leading cause of death among those 10 to 34 years old, and is the leading cause of death among US military members. We don't have a great way to predict how many attempts there are because we really need people to come in to see us in order to know that they have attempted. But there's a belief that for every one death by suicide, there are up to 25 non-lethal suicide attempts. So this is a pretty pervasive problem in the US. And I think this is a good time to mention a quick myth about suicide, because I think we look at these stats and we look at these numbers that are staggering and we think, okay, well, what can we do, right off the bat, what can we do? And one thing we can do is talk about suicide, so kind of reduce some of that stigma and ask people, our loved ones in our community, people we're concerned about, if they're having thoughts of suicide. And that big myth that asking someone about suicide is going to put thoughts in their head. This is something we hear a lot, and the research shows us that this isn't true. So asking someone about suicide will never put that thought in their head. And actually, it can kind of be validating, because the times that we're going to ask someone that, it's when they're, acting a little bit differently. They might seem more stressed. There's something going on that's making us ask that. So even if they say, no, I'm not having thoughts of suicide, that gives us the chance to be like, all right, well, what else is going on, right? What's happening? And allow them to know that like, hey, yeah, we're okay talking about this with you, and making sure we kind of get you to help if needed. So jumping from our myths back to some rates of suicide, I think one question that comes up a lot is differences between men and women when it comes to suicide. So women account for 75 to 80% of all suicide attempts made in the US, but men account for 75 to 80% of all deaths by suicide. So this is a big difference, right, between men and women. One of the things that we think accounts for this difference is the violence or lethality of methods that they choose. So 67% of male suicide decedents use a firearm, whereas 33% of female decedents use a firearm. So women are more likely to use methods such as overdose, which tend to have lower fatality rates. So overdose is fatal about 2 to 3% of the time. So 97% of the time, if someone attempts suicide by overdose, they survive. Counter that with firearms, which has an 85 to 95% fatality rate, meaning that only 15 to 5% of the time when someone attempts the firearm, they'll survive. So we think this is one of the big things that explains the difference in rates between men and women, but there are obviously other differences as well. And research is still trying to figure out exactly what some of these other factors that might account for these differences may be. So chatting a little bit about the military and first responder community. So we touched on quickly before, but suicide is the leading cause of death for military service members, and it has been since about 2014 when it surpassed accidents and combat. We also lose 17.2 veterans every day by suicide. So again, this data is coming out of 2019, but this is the most up-to-date data we have. So huge problem within the military, huge problem when our service members leave military service and our veterans. And this is also a big problem within the first responder community. So we're going to chat about each kind of first responder role independently, but I want us to keep in mind that overall in the general US population, 13.5% of people have thoughts of suicide. So we think about that 13.5% in the general population compared to 25% of female law enforcement officers and 23.1% of male law enforcement officers. So that's saying that female and male law enforcement officers are having 10 to 12% higher rates of thoughts of suicide in their life than the general US population. Firefighters also have very high rates. It's up to 46.8% in one study. So they're again, more than double what the general population feels. And then this EMT number could be a little deceiving, and I want to talk through it a bit. So we see here that 10.4% experience severe lifetime suicidal ideation. So suicidal ideation is just another word for thoughts of suicide. And this term severe, I think, is where this number can be, a little deceiving. So when we kind of look at it from a clinical perspective, we'll have thoughts of suicide, which is like yes, no, generally, and then we'll also kind of rank things from like clinical significance. So someone who has severe thoughts of suicide is kind of a different group than someone who has like passive thoughts of suicide. But again, they're all having thoughts. So it's likely that more EMTs have thoughts of suicide overall, but there's 10.4% who are having severe thoughts of suicide. And I think this kind of highlights in the research one thing that the lack of consistency of just overall being able to get percentages and just understanding of how thoughts of suicide and attempts of suicide and deaths by suicide differ within different first responder roles, as well as in military roles and among veterans. So overall, we have been moving in the wrong direction with suicide rates. So you can see here that suicide deaths have gone up while deaths by traffic accident have decreased. And unfortunately, we're not kind of mapping on to some of the progress other nations have made. So in other countries, there's been a decrease in suicide rates in the last few decades, whereas here in the US, we've seen a 33% increase in the last 18 years. So this kind of begs the question, what's going on during the pandemic, right? This is a big time of stress and has been since March 2020. What's been happening with suicide rates? So as a reminder, suicide data takes about 2 years to come out. So early in the pandemic, when everyone was like, what's going on? It was really hard to predict because we didn't have the data. We didn't have the numbers yet. So it's difficult to predict on a national level, but there are a bunch of research groups that have done some studies on this. So overall, what we're seeing is suicide rates are not rising. So vast majority of the country's suicide rates are not rising and have not been rising during the pandemic. In Maryland, there was one study that found that suicide rates rose for Black and African Americans or African Marylanders. And what we're seeing here is that, this is one of those cases of there's never one cause, right? There's never one cause for suicide. And 2020 threw a whole lot of curveballs at people. So both, the pandemic, financial stressors, social justice movement, like, essential workers were really being taxed. So we can't chalk this totally up to the COVID pandemic, but it's important for us to think about, why might this be the case and how can we support individuals who are experiencing higher rates of suicidal thoughts? So I think this is interesting because in the beginning, in March 2020 and the months that followed, there's a lot of talk and a lot of news coverage about suicide rates are going to go up. And a lot of the leading experts in the field kind of said, hold on a second. We're not really sure that they're going to. Now we're sure that, they didn't rise drastically during the pandemic. And their reason was because during hard times, many people pull together, right? So there's something about like difficult times that might kind of counter what we think is going to happen with suicide rates. So again, it's important for us to keep looking at this, see what the CDC data comes out saying, and then also track this for the future, right? Like we've had some pretty big economic stressors come our way during the pandemic, as well as job stressors, especially for essential workers. So we want to track this for years to come, not just in the present moment. So overall, I kind of hit on this before of how we're going in the wrong direction, but a recent study in 2017 found that we are no better at predicting death by suicide than we were in the 1950s. So this is obviously not good. And this has really kind of pushed people to think about how we think about suicide prevention differently, right? If we're not good at predicting it, what else can we do? And I think this is a good time to move into our discussion about firearms and suicide and really this idea of means safety. So means safety is arguably our best prevention effort to prevent suicide. And what means safety means is making a method for suicide less lethal or less readily available. So less deadly and less quickly available, or having quick access. So this can be applied to a number of means, right? So we think about something like medication. We might encourage people to, hey, like, let's put that medication in a cabinet and lock it, right? Just put a little bit of barrier between you and the medication, especially during a time of crisis. We can also ask pharmacists to hold some of the meds so that we reduce how much medication is in the house. And again, this is really helpful during times of crisis when people are under stress. We kind of put those barriers in place. So we're going to focus on firearms, though, in our discussion of means safety, and I will get into why. But before I do, I want to chat a little bit about my plan when it comes to firearms. And firearms are, a divisive topic, and they can be tense to discuss. So I want to make sure we're on the same page about what I am here to do and what I'm definitely not here to do. So I'm definitely not here to vilify gun owners, to claim superior experience with firearms, or to claim that means safety is going to fix the whole problem, right? I think it serves a role, but it's definitely not going to fix the whole problem. This is also definitely not a gun grab. What this is much more a discussion of the role of firearms in suicide, kind of what we know from research, and my thoughts on a path forward. So I hope that kind of clarifies what I am here to do, and definitely what I'm not here to do as well as we kind of dive into this discussion. So why are we talking about firearms when it comes to suicide, right? I had mentioned that means safety can be used with a whole lot of different methods. So why am I choosing firearms? So firearms account for 51% of all deaths by suicide. So they're used in less than 5% of attempts, but since they have such a high lethality rate of 85 to 95%, they're the most lethal method and they account for the most suicide deaths. And I like to kind of throw in another myth here about suicide that I think really ties into this idea of, making firearms safer, making methods safer. And it's this idea of means switching. And what I mean by that is a lot of times we get the question of, well, if someone can't access a firearm or can't access medication, won't they just find another way? And what we know from the research is that they don't. So there's research done with jump barriers that were put on bridges. And what we found was suicide rates for the whole community went down. So it's not that people will go to the bridge and see a jump barrier and just go somewhere else or do something else. It really does bring suicide rates down. The other thought of that is, right, there's the exceptions to the rules, right? There are people who do switch methods. Now, if they're switching from a firearm to another method because that firearm is not readily available to them, that other method is far less lethal. So firearms are 85 to 95% fatal. The next most lethal method is hanging with like about a 75% fatality rate. So we think about that, right? Like every other method gives people a chance to survive and a chance to have a suicide attempt instead of a suicide death. And a point of hope there is, we don't want people attempting suicide or dying by suicide, of course, but most people who attempt suicide, a vast majority, will never go on to attempt again. So second chances really do matter here. And when people use a firearm, they're not usually given a second chance. So a big point, and I think this is another question that comes up a lot, is firearms do not make people suicidal, right? We're not here to say that having a firearm is going to make someone suicidal. But I think this theory kind of helps talk through the role that firearms might play within like suicidal crises and whatnot. So Dr. Thomas Joyner is a professor down at the University or Florida State University. And he created the interpersonal theory of suicide. So what he says is that we need this sense of thwarted belongingness, so feeling like we don't belong or feeling alone, and perceived burdensomeness, so feeling that you're a burden to others in order to have a desire for suicide or thoughts of suicide. So these two things are what result in thoughts of suicide. This third component, capability for suicide, is essential in order to be able to attempt suicide. So capability is, that ability to kind of overcome our natural instinct of keeping ourselves safe, right? When we touch a hot stove, our hand pulls off. We're kind of programmed to keep ourselves safe. So it's that ability to overcome some of that. And what we see here is that firearms, like access to firearms and familiarity with firearms, increases capability for suicide. So it kind of has that go up. So then that right here can lead to a suicide or near lethal suicide attempt. And this is really where we see firearms playing in. So again, not playing into that desire or thoughts of suicide, playing more into the availability of methods if someone does have thoughts to act on those thoughts. So the risk of firearms in the home, I think this is important to touch on and chat about before we move on to mean safety. So the risk for suicide increases by 3 to 5 times when a firearm is present in the home. And that risk actually goes up if the firearm is stored unsafely. So what I mean by unsafely, because I know everyone defines safety a little bit differently, is I mean loaded and unlocked. It would be unsafe in my vocabulary right now. And I think it's important to mention too that this risk actually increases for every member of the home, not just for the firearm owner themselves. The good news is that we have seen that safe storage may protect against suicide risk, or kind of, reducing that quick availability may protect against suicide risk. So abroad, over in Israel, they did a study with the Israeli Defense Force, and they saw that there was a 40% reduction in young service members' suicide rates when they instituted a policy that did not let them take their firearms with them on leave. In the US, a similar study hasn't been done, but we have seen that unsafe storage, so again, that loaded and unlocked, does increase risk for suicide, whereas safe storage, so unloaded and locked, can reduce suicide risk. So what do I mean by mean safety, right? So I mentioned that this means making a method for suicide less lethal or available, right? So unloading a firearm makes it less lethal, or even readily available, right? People have to then do something in order to use that firearm. So how does this apply to firearms? So again, it's storing unloaded and locked is kind of what we talk about with mean safety. But this is not a one size fits all approach, right? So, we have worked with a lot of firearm owners who tell us, home protection is very important. Like that is their reason for owning a firearm. And that's super valid, right? We got to find a way that you still feel safe having your firearm in order to protect your home. And also, if you're in a crisis point, we got to make sure that we're also keeping you safe as well. So things like biometric safes have been a pretty big hit because they're quick and easy to access in case of a home invasion, but also that does put a barrier between someone and a method for suicide during a time of crisis. And that's the big part here, right? Suicide's a crisis point. So it really is this like peak. People can't plateau at a suicidal crisis point because it's so emotionally draining and emotionally difficult. So being able to get someone through that crisis point and then connect them to services, make sure we're getting them help, that's really where mean safety is coming into play. Another kind of newer innovation, I guess, that has come up is temporarily, voluntarily storing firearms outside the home during a time of crisis. And we'll tie this into that innovation I was talking about of firearm safe storage maps. But this is, again, something that's not forever, right? Suicide's a crisis point. So if we can just, reduce access during that crisis point, and once you're feeling a little bit better and people, get access to care or, kind of get through that crisis point, you can definitely bring those firearms back into the home. So the bottom line with this is ready access to firearms dramatically increases the risk for death by suicide. And mean safety is probably our most powerful suicide prevention tool, but it's not widespread. And this, I really think, is a communication problem around mean safety on part of researchers and clinicians and those of us kind of working in this space, right? We need to do a better job explaining why it's important, when it's important, and what people can do. So with this communication part, I think this is a good time to tie in the states with firearm storage maps. So there's 5 states, Colorado, Maryland, Mississippi, New Jersey, and Washington, that have created firearm safe storage maps. And what these are is a list. So it kind of looks like this. Here's an example of New Jersey's, where people can go and find firearm dealers or shops or ranges that have said, like, yes, people can temporarily, voluntarily store their firearms here with us. And so during a time of crisis, people can go on and say, all right, I need to get my firearms out of the home. I'm not feeling too great. Where can I, temporarily store them? We've also heard that people have been using this a lot when it comes to like life things, right? Like their grandkids are coming to visit, or they're going to be out of town for a while and are worried about theft and they want to store their firearms outside the home, or moving. That was one I hadn't thought of that we've heard a little bit now. And I'm like, that actually makes a lot of sense, right? You can kind of store a firearm at a trusted location for a few days while you're moving, and then just go pick up your firearm, when you're feeling like, all right, it's just me and the people in the home who are used to having firearms. I don't have to worry about someone else, accessing my firearm. So these maps are kind of a cool tool, can be used. And I think it's starting to kind of bridge that gap between our communication issue around mean safety and actually giving people a usable tool. This is the New Jersey one. And since we're in Jersey, I'll highlight this one. So this was created by the New Jersey Gun Violence Research Center. So if you just go onto the New Jersey Gun Violence Research Center website, you can see there's a New Jersey firearm storage map. You can click there, play around with it, kind of see what it's like. And we're still kind of working on updating and adding to it. The firearm shops were contacted to make sure like they were okay being listed and participating. So you can see we have some areas, kind of central Jersey area, that we're still looking for some places, and still going to try to keep adding to this as well. So some concluding thoughts before we wrap up and answer some questions is just what we reviewed today, right? Suicide's a major problem in the US. So we're seeing rates are going up, rates are rising. They've gone up 33% in the last 18 years. And we're not really better at predicting suicide than we were decades ago. We're also seeing high rates among military members, veterans, and first responders. And I think this really highlights the fact that we need to be asking these folks, about suicidal thoughts, as well as creating like useful interventions and skills and tools to help people, to feel better. And like I said, we're still learning a lot. We're learning how to prevent suicide, and there's a lot of research that still needs to be done. And mean safety is arguably our best prevention method. So right now, when we're not really sure exactly how to predict suicide and who's going to go on to attempt suicide, making sure people understand mean safety and can make their home, safer in times of crisis is really important and can definitely help reduce suicide rates. So I want to thank you guys so much for listening. And I always like to just end with putting up the suicide prevention hotline numbers for you to take a look at. So the Suicide Prevention Lifeline is open 24/7, 365 days a year. There's also a crisis text line if people like to use that. So these are great resources. They have, trained staff on call all the time to answer these calls. So I just like to throw those up there and encourage people to just throw them in their phone, because you never know when you or someone else in your life might need that. So you can have access to those numbers. So I'm ready to take some questions.
That was fantastic. Thank you so much, Allison, for that great presentation on such an important topic that really does need to be addressed and studied. So we really appreciate that. I have a couple questions for you. When you're talking about the crisis point and when people are extremely stressed out, is there any type of advice that you might be able to offer for ways to support your mental well-being through stressful times, whether that be a global pandemic or, a specific life event that people might come across?
Yeah, for sure. I think, the last year has really cued us all into like super stressful events that are happening, right? And they're affecting us all a little bit differently. So yeah, so both during crisis points, as well as just like trying to, manage global pandemics, other stressors that come up that are more personal. I definitely like the hotline numbers. I think these are great, especially at a true crisis point, right? When you need to talk to someone and really be able to express, especially thoughts of suicide, and make sure you keep yourself safe. They're a great tool. There's also just a lot of, kind of moving away from suicide into more mental health and mental well-being. It's we got to do a lot of self-care, right? We got to take care of ourselves. And I think of this analogy that we use a lot in the clinical world of, when you're on an airplane and they say, put your mask on before helping someone else. It's kind of the same way with our mental health, right? If we don't take care of ourselves, if we don't put that mask on, it's really hard to take care of other people. So I feel like a big one that I've seen on, commercials starting to have is like mindfulness. I know Calm is one of like the apps that has all those commercials. I think mindfulness is great. There's like free things on YouTube around that. And some people really cling on to mindfulness. It can also be really hard to be mindful. I'm definitely someone who likes it, but is like, wow, in this moment, it's hard to be mindful, right? So I think finding just kind of the skills that work for you, writing things down, right? Like writing down, hey, when I'm stressed out, like I found it really helpful to journal. So I'm going to, make sure I do that. I found it really helpful to do mindfulness. I found it really helpful to, take my dog on a walk. Just making sure to kind of keep that list almost like a coping card type thing to be like, what works for me and what can I lean on during those times of stress. And then also, obviously I'm a little biased as a clinical psych student, but I think just like getting some mental health care as well to kind of add to our toolbox, right? So we have some skills like that we've all used all the time to get through stressful things, but I think some therapy skills and treatment can help just kind of add to our toolbox, especially when, like we said, the world throws us curveballs, as well as just, I feel like in everyone's personal life, there's also a lot of curveballs. So that's a great question.
That's great. Thank you so much for sharing all of that. My next question is about the stigma that we've seen around overall mental health, but also suicide as well. And, people not feeling comfortable talking about it if it's something that they've considered or have attempted, and there's a stigma in society about talking about that. I was wondering if you could just share a little bit about the importance of breaking down that stigma so that we can hopefully advance, research and also programs around getting people the help that they need.
Yeah, that's another great question. And I think stigma around mental health and suicide prevention it is so pervasive, but I keep hoping and I keep seeing, I think, areas of promise that I think we're moving towards a society and a culture where we can talk about this more, right? I mean, there's a presentation on it right now. Like this is a great step in that direction. And I think this comes from I think stigma sometimes comes from like not really understanding, right? Because suicide can be scary. And someone tells you like they're having thoughts of suicide, it's like, oh my gosh, I need to figure out how to keep you safe. And it's like a panic moment almost. So I think, just spreading education out there around suicide. So, some of our rates we talked about, there's more attempts than there are deaths. Kind of on top of that, right? 10 million Americans have thoughts of suicide every year. That's a huge number, right? Less go on to attempt, less go on to die. So there's a lot of people who are experiencing this. So I think trying to remind people that they're not alone. They might feel it because it's not talked about. And talking to trusted sources, right? We mentioned asking about suicide, but also, if you're having those thoughts and concerned about stigma, and I think stigma is sometimes more pervasive in certain cultures. We talked about the military a little bit, and just feeling like, who can I go to and who can I chat with that I'd feel more comfortable is a good way to go about it as well. And I think that there's a lot of other ways to learn about suicide and to help reduce those stigma pieces or kind of stuck points. There's AFSP, which is the American Foundation for Suicide Prevention. They have a lot of trainings. There's like local chapters. So there'd be like I think there's like a New Jersey chapter that you could just do additional trainings to learn about. They have a program that's called like Seize the Awkward. Like, we know this is going to be awkward. Let's still talk about things. And there's a lot of great work being done, I think, to try to break down that stigma by researchers and clinicians. But I really do think just like, you guys coming to this presentation and listening to it, like that's how we're going to get there, right? Like we can't just have us think this isn't stigmatized. We need to kind of get it to a community level.
That's great. Thank you. And just my last question for you is that I would love to hear about what your future studies and future research might look like. What can we hope to learn about in the future when researchers like yourself are continuing to study these issues?
Yeah. Oh, I like talking about research all the time. So thanks for setting that one up for me. So the New Jersey Gun Violence Research Center is doing a ton of research on obviously firearms in general, but firearms and suicide, kind of ways to work with firearm owners to store their firearms more safely. Again, respecting these rights and respecting their desire to have access to firearms for, let's say, like home invasion and whatnot. Some of the stuff that I'm working on that I think is interesting and hopefully kind of points us in the right direction is looking at some data from those who have died by suicide and trying to figure out who these folks are, what we can learn from them in order to see, who's at risk for this in the future. So there's some big data sets by the CDC and other organizations like that kind of let us do that. So yeah, that's kind of the one that I'm liking the most. And I think another kind of relevant thing that me and my lab mates and colleagues are working on is looking a little bit about at like essential workers, right? So this was a huge, like, stressful point. And what we're seeing is essential workers were experiencing higher ideation, so thoughts of suicide, and more stress related to COVID-19. And those who identified as BIPOC, so Black, Indigenous, people of color, had even higher rates of suicidal thoughts and higher stress. So we kind of want to keep looking at that, keep breaking it down and seeing, who are the groups right now that are really in need and really struggling, and how can we kind of meet people where they are in order to stop that transition of thoughts of suicide to attempts to death and really kind of help people live like lives worth living.
That's great. Thank you so much, Allie. And
Absolutely.
thank you for this presentation overall. To everybody watching, thank you so much for joining us today. This presentation in full will be available on our YouTube page, so you can just search Rutgers Institute for Health, Healthcare Policy, and Aging Research to find us there. Thanks again, everyone. Have a great day.